This is the Paltalk News Network.
The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVN Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users on demand on iTunes and on YouTube and on my blog, GaryBaumgarten.com, where you're encouraged to post your comments whether you agree with yours truly or not, no retribution. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. I welcome you to the show, and I remind you to go early and often to read the Paltalk News Network site. Yes, paltalknewsnetwork.com, early and often, just like voting in Chicago, to see stories that you may or may not see, hear, or read in the mainstream media. One of the stories today, aside from the fact that, of course, it is St. Patrick's Day, and I am your host, Gary Baumgarten, and I welcome you to the show, and I'm going to talk to you a little bit about that, and I hope some of you were able to join me live from the St. Patty's Day Parade on 5th Avenue here in New York City. What great fun that was. But joining us right now is our good friend and physician, and he wears a new hat since the last time he's been on the show. He is now candidate for the United States Senate in Ohio, Dr. Michael Pryce. Dr. Pryce, welcome back to News Talk Online on the Paltalk News Network.
Thank you very much. I'm glad to be here.
We love having you here. And Dr. Pryce, you may have heard the late-breaking news, but two Democratic members of the United States House have stopped being holdouts. They have flipped, and they are now supporting the health reform legislation. I'm talking, of course, about Dennis Kucinich from your state of Ohio, and another Democrat by the name of Dale Kildee from my original home state of Michigan. And they are inching closer and closer to having enough votes, the Democrats are, to pass this health reform package. Last time we had you here on the show, you expressed reservations about the package not going far enough.
Well, that's correct. It's and Dennis Kucinich is, for a year now, he has been screaming out loud, and he makes a lot of noise. He was the former mayor of Cleveland, and he drove Cleveland into default, and so he's had lots of experience driving governments into default. And by the time they get done with this healthcare system, I think our country's going to be in big trouble if they push this through. But I don't know who this other fellow is, Kildee. But just from what I've been listening to on the lines and knowing people that are in the know down there in Washington, they get one, they pick up one, they drop another. There's a lot of pressure on people not to vote for this. So I'm still confidently scared that it's not going to happen. But you're right. This program, it really isn't healthcare. What we have right now is the most disjointed system in the entire world. It's the most expensive. Nothing is going to get better by this other than the fact that they say they're going to get rid of things like pre-existing conditions. But my complaint about that is that if you have a pre-existing condition, how many times have you seen the government change names? Like there was a bill that came up here and they didn't want people to think they were being taxed, so they called it a fee. All the insurance companies have to do is change the name, and because the law is going to be written in a certain way, they're going to get out from underneath it. And so...
Go ahead.
I'm just terribly concerned that over the long haul, that nothing is going to change except it's going to get incredibly more expensive.
Well, here are some of my concerns. You know that I, like Dennis Kucinich, favored a single-payer system where everybody in the country was on the same basic plan. And you could take that card into any doctor in any state in the United States of America, present it, and get basic treatment. And I guess there could be supplemental health insurance that one might qualify for, but I'm concerned about the fact that the public medical programs that we have now are not working. And as much as I want one, I'm concerned that the government can't run one. There have been many stories recently about doctors dropping out of the Medicaid program because it just doesn't pay them, not even as much as it costs them to see the patient, much less for the care. Now, you are a practicing orthopedic surgeon. There is a story today in CNN, and let me read you the lead to this story on CNNmoney.com. A kid with a fractured leg highlights the problems Dr. Jacqueline Gottlieb's pediatric practice is having with Georgia's Medicaid system. I needed to send the child to a pediatric orthopedic surgeon, said Gottlieb. I couldn't find a specialist who took Medicaid. She could not find a doctor to treat this child. Now, you're an orthopedic surgeon. Are you caught in that same kind of a financial bind where in Ohio you are reticent to take Medicaid patients?
We have, as a matter of fact, a year and a half ago, they went managed care in Medicaid in Ohio. And what happened was that when they went managed care, they started making my girls call to get permission to see even patients in the post-op period where there's no charge. And we had to call and get permission, and my girls would call, and they would put them on hold for 45 minutes. Now, mind you, Medicare pays us about 15 to 20% of what we normally charge, and we lose money on every Medicare patient. But Medicaid pays 60% of what Medicare pays. And so we take a bigger hit from Medicaid, and now they're trying to make my girls fill out more paperwork. They have to call and get an approval on everything, and we said, we're not doing that anymore because we don't have that kind of time. And so we stopped taking it ourselves a long time ago, not because we don't want to see patients and not because we don't have compassion for the sick. We just cannot do it. The problem with the program is that it is so complicated and so poorly administered, let alone